This presentation is entitled Hospice, another core topic for Tamarisk companion volunteers. Now, it's not uncommon for people in the community to mistakenly assume that Tamarisk is a hospice program. So you may wonder why we have a discussion about hospice as a part of the essentials of our volunteer training then. While it's correct that Tamarisk is not a hospice organization, it is true that the hospice philosophy of care is at the heart of Tamarisk's mission. And if you've already viewed our founder Gretchen Hansen's presentation about the history of Tamarisk, you'll have a sense of this connection. It is also true that Tamarisk often does care for people who are receiving hospice care. And so my goals for this presentation are 1, to help you understand hospice care, 2, also the similarities and differences between Tamarisk and hospice organizations, and 3, then to give you a basic understanding of your role as a volunteer in the hospice setting. Now, as it says here, hospice in a nutshell is a specialized form of care for individuals in the last stages of a terminal illness. Hospice care provides physical, emotional, and spiritual support for dying individuals and their families. Now, please make sure you have your binder with you to follow the presentation and to be ready to refer to some handouts that are in the section labeled Hospice. So let's begin. So just what is hospice care all about? This statement of psychiatrist Elizabeth Kubler-Ross sums it up well, and I'll wait here for a moment for you to read that. Hospice is not about a building or facility. It's about a way of caring for people. The hospice philosophy values life. It's about living, not about dying. It's often been said that hospice is about adding life to one's days, not days to one's life. Now, in your binder, you'll find a 2-page summary of the hospice philosophy and history, so please take time to read that in conjunction with the presentation. In a nutshell, think of hospice care as care that affirms and emphasizes the quality of life in the remaining days, weeks, or months of a person's life, and regards dying as a normal process. Hospice care neither hastens or postpones death, but instead, it provides relief from physical, emotional, and spiritual pain that often accompany the terminal illness instead of focusing on a cure. Hospice care offers holistic care by providing a team of people that attend to physical, spiritual, and emotional needs. It focuses on the person, not the disease, and also cares for the family. Let me take a moment here to make an important connection. I said as we began the discussion that the hospice philosophy is at the heart of Tamarisk, and so all of the statements you see here are essential to how you will care for the families we serve. All of these statements are in essence an expression of what we mean when we talk about Tamarisk and the concept of presence. And so I want you to keep this discussion about hospice in mind when reading Gretchen's booklet entitled Presence, the Key to Hospice Care Delivery. Let me read a portion of the editor's comments found at the beginning. She states, "Once we understand that hospice is a philosophy, not a place, and that spending time with those who are on the last portion of their life's journey is a gift, not a burden, our attitudes change. Suddenly we look into our hearts and our memories and realize that we have held an unarticulated wish deep in our soul. We remember those we have loved and lost and wonder what could have made the experience less painful. This paper describes how through our presence we can ease some of their pain and to together discover meaning. I feel honored to work with the volunteers of Tamarisk Resources and to present this monograph to help explain the philosophy that is the foundation of our efforts. Hospice caring is the philosophy Tamarisk lives by. Providing the gift of presence is the way that we offer that care." Now, the idea of offering comfort and care, hospitality to those on a difficult journey, is deeply rooted in the human story. Literature discussing the history of hospice care point all the way back to the Middle Ages, and at the homes and monasteries that offered a place for weary travelers to rest and refuel for the journey ahead. You see, this tradition continued in the personal care offered by bed and breakfast, perhaps in the United States today, or hostels of European countries. But perhaps one of the most important places for us at Tamarisk to connect with in order to understand the hospice philosophy is the ancient story of Abraham in the biblical book of Genesis. In chapter 18, a story is told of how Abraham is visited by three men, weary from a long journey through the desert. Though they were strangers, Abraham did not hesitate to ask them to stay while he attended their needs and prepared a meal for them. He offered this care, this shade and rest, under a tamarisk tree, and then sent them on their way with a blessing, with no thought of reward or repayment for his efforts. In Gretchen Hansen's monograph on presence, she emphasizes this point, stating that he offered this selfless care the way any friend would. Now, this is the heart of hospice care and how Tamarisk seeks to serve each family we encounter on their often difficult journey towards the end of life. So with that heart and history in mind, here's a quick summary on how the modern hospice movement has developed and how the term hospice has come to be associated with care offered specifically to those drawing near the end of life. And again, I won't read the bullet points for you, but simply call attention to a few key facts. The modern hospice movement began in England. This is why our founder, Gretchen Hansen, chose to travel there and received a significant part of her training in that context. And second, Congress's decision to adopt the hospice care benefit initiated major changes in end-of-life care and paved the way for various hospice programs and residences that are a part of our communities today. So let's take a moment to be sure you understand some important things about hospice care. If there is any point in this presentation where I would require you to take notes or to highlight, this is it. So please grab your favorite pen or highlighter, and here we go. So first of all, it's important to understand that modern terms, when someone is said to be, quote, on hospice, it means that their physician has determined that the patient's prognosis is that they have 6 months or less left of life. It is at this point that the hospice care benefit enacted in 1982 kicks in, and a range of services that are covered by insurance become available to the patient that had not been previously. In most cases, there's no cost to patients for hospice services. It's paid for by insurance or Medicare or assistance. Hospice care can be received in whatever place the patient calls home. Their home, an assisted living, nursing home, or an apartment, or patients could even choose to spend their last days at a residential hospice if significant medical care is needed. So here's 3 important things that you'll need to be aware of as a Tamarisk volunteer when you are serving a family that is connected to a hospice organization. First, be aware if the patient has one of these forms listed. We will talk about these at the training event, but each of these forms are often part of a health care or advance directive that the patient and their family may have filled out in order to clarify their wishes about care and end-of-life issues in case they are unable to make decisions. So just to summarize them here for you. POST stands for Physician's Orders for Life-Sustaining Treatment. DNR stands for Do Not Resuscitate. DNI stands for Do Not Intubate, and both of those give emergency medical teams permission not to follow required procedures in a medical emergency. Patients and families at times consider these options when the patient is frail and would be more likely injured than helped by those procedures, or at times when their age or progression of a disease makes those procedures unwanted. It's also very important for you to remember that when a family has made arrangements for hospice care, that they have chosen not to unnecessarily prolong life and thus would not want to initiate the invasive procedures or expense of an emergency 911 call. Although this would be very unlikely, if you happen to be there at the moment of death or even when there's an urgent concern about a patient's well-being, the appropriate number to call is the hospice provider. As you are matched with families, Tamarisk staff will be certain to let you know when a family is connected to a hospice agency and what this 24-hour phone number is, if needed. And finally, if you are present at the time of death, please be sure to stay as long as needed. The general guideline would be not to leave the patient if they had been alone, of course, or even to leave a caregiver alone. Please stay until another family or the hospice agency has arrived. Again, this would be very unusual, but we want you to be prepared to offer appropriate care, even in this moment, if needed. Now, it was noted earlier that hospice care organizations offer holistic care, a team approach that seeks to address not only the medical needs associated with the patient's illness, but emotional, spiritual, and overall physical well-being. Tamarisk families receiving hospice care will have a team of people available to them, and they may have any of the professionals noted here visiting regularly or as needed. Other common members of a hospice team are music therapists, massage, and even pet therapy. Now, at the bottom of the diamond, you notice that a hospice volunteer is part of the team. This volunteer serves much the same way as our Tamarisk volunteers do, and there are two common reasons why a hospice organization may contact Tamarisk while serving a family. First, they may have not been able to find a volunteer within their organization to serve the family, and so they refer, and Tamarisk comes alongside to fill the role. Second, the family may have a volunteer assigned by the hospice organization but would benefit from more support than their volunteer can offer, and so our volunteer supplements the help that they are already receiving. And again, as a Tamarisk volunteer, you'll always know when this is the case and know which hospice agency is working with them and have a name and contact number for that. Now finally, I want you to be sure to understand the similarities and differences between hospice care and Tamarisk services, and also to explain a relatively new idea or at least term in medical care, palliative care, how that fits in the mix. Well, in essence, hospice care is comfort care at the end of life. Palliative care is comfort care offered at any stage of a serious illness. Both hospice and palliative care provide relief from pain and other uncomfortable symptoms. Hospice and palliative care are appropriate for people with a terminal or serious illness, regardless of age or gender, religious faith, or cultural background. Now, Tamarisk care in many ways encompasses both of these types of care as we strive to serve families at any stage of a life-threatening illness that requires significant support, and at times walk with a family through years of changes, while they perhaps may be receiving formalized palliative care and continuing on during those last days of life when they may be perhaps receiving formalized hospice care. Now again, I won't read all of these bullet points for you, but I offer these short lists as a way to help you understand how Tamarisk fits in with other forms of care available, and how we see ourselves as part of a larger team in the community meeting the needs of families facing life-threatening illness. We'll talk more about hospice and palliative care during the training event, so to be sure to note any questions you have or clarifications that might be helpful. Now in your binder you'll find a list that's called Characteristics of Hospice Volunteers, and that goes along with these last two slides. Tamarisk's vision in your role as a volunteer is broader than that of just simply a hospice volunteer, but these characteristics reflect the heart of our mission in any family situation you might encounter. So as we finish our discussion, I'd like to give you a few essentials to keep in mind, to give you a good start in understanding just what to do or to focus on when you begin visiting our families. So in a hospice or end-of-life setting, first of all, it's important to be aware of physical limitations or challenges that this patient faces. Tamarisk staff will have already gathered information for you at the initial assessment, which you'll be given. This should be part of a conversation at that match meeting as well. Common things to be aware of are concerns about falling, diet restrictions, eating challenges, and toileting. It's important for you to be attentive also to their level of pain and overall comfort. We'll talk about this more during our training event. How about make a note here of any methods you're aware of for determining if someone is in pain or how much? Or perhaps how would you tell when they're asleep or unable to speak or communicate well? Tamarisk staff will ask about concerns in this area during the assessment, and it's not uncommon in a hospice situation for pain to be an ongoing concern. And of course, at the heart of Tamarisk care is to offer presence. Well, would like you to take a moment now, and perhaps even pause or stop the presentation if you'd like, and list at least 3 ideas for what it might mean for you to, quote, be there for the patient who has 6 months or less of life. And then also to list 3 ideas for what you might do to support the caregiver or family of someone who's expected to pass away soon. Now, I suppose this bullet point could be one of your ideas, and that's okay. You can still count it if you wrote it down. But this is a good time to mention one of the unique values of the Tamarisk volunteer. Now, because you don't have a set agenda when you visit, it's not uncommon for our volunteers to be in a position to talk about the dying experience with the patient. This may be practical discussions about arrangements, spiritual discussions or prayer as they prepare for that time, or emotional support and a listening ear as they express fears or concerns about what it would be like. It is truly sacred space to be able to walk with someone towards the end of life, and we'll take time during our training to give you some pointers for good and natural conversations. And we've already talked about this one, but just to restate that if your family is receiving formalized hospice care, you are part of that team, so you should feel comfortable connecting with that team, and certainly as needs or questions arise. And finally, don't ever feel like you are alone as you visit your family. Tamarisk staff will be in regular contact with both you and the family, and so will be familiar with the situation and able to offer advice, resources the family might need, or perhaps give voice to a question or concern on your behalf. Our role is to support you as well as each family that you serve. Now, as we've noted, Tamarisk care encompasses both hospice and palliative care settings. So let's finish the presentation by giving you some ideas of what to expect when you connect with the patient and family earlier in the disease process. While Tamarisk would not perhaps connect with the family at the moment of being diagnosed with a life-threatening illness, the general rule of thumb is for us to become involved when there is significant challenge for the family or caregiver, or a patient that's unable to be on their own. Well, yes, this first bullet point here is intentionally repeated from the last slide because no matter how early or progressed someone's illness, you need to be aware of their physical challenges and limitations. It's likely when you are connecting with them earlier in the disease process that their challenges and limitations will change. And so you'll need to develop a good habit of asking questions, observing, and be ready to adjust what it means for you to offer care as you go. And yes, again, no matter the progression of a disease, you'll want to have the patient's level of pain and overall comfort on your mind as you visit. Now, being present for a family and patient earlier in a disease process can be quite different than the patient near the end of life. When connecting earlier in the process, it's more likely that you'll be doing more things actively with the patient, perhaps even going on outings. They may be more able to participate in things with you, or simply not need you to do as many things for them. So once again, I'd like you to take a moment, stop the presentation or pause it if you'd like, and list 3 things that you think you might enjoy doing with a patient who has relatively few limitations. And also 3 things you might enjoy doing in order to support the caregiver or family in this situation. Be prepared to talk, again, but conversations might be different. It will be more common for the patient that you serve to experience losses and changes along the way as their disease progresses. It's okay and certainly good to develop an atmosphere of openness so that they feel comfortable sharing emotions, questions, or fears about how their lives are changing. We'll talk more about this in training and in the presentation about grief, but I'll note here that it's important for you to be ready to talk about the physical changes especially, so that you're prepared to offer good and appropriate care as a Tamarisk volunteer. Well, it follows then that as the patient and family go through changes, that there might be a time when they need additional or different support and perhaps need to consider an assisted living or other residence, for example. Now, by no means do I expect you to become aware of all the myriad of services in our community. We know that you are not social workers, of course, but please do keep a listening ear and if appropriate, give Tamarisk staff a call, and we might be able to give them some good connections. And finally, once again, no matter the progression of your companion's disease, of course, Tamarisk staff is here to support you, as you might have questions, concerns, or need some ideas on how to care well for the family. Not only Tamarisk staff, but other Tamarisk volunteers are a valuable resource and means of support for you, so please don't ever feel like you have to go it alone. Well, at this point, I hope you have a better understanding of the hospice philosophy, how Tamarisk fits in with palliative and hospice care organizations, and some practical ideas for how you can begin to offer care in each of those settings. So as we finish the presentation, please take a moment to write down any thoughts, questions, or concerns, anything you'd like to bring up during our discussion at the training event so you don't forget. Thanks.